We are Group 5, and we're here to present Healthcare Innovations in Brazil. This presentation looks at both the Brazil and US healthcare systems, and we identify innovations to both systems that will improve their healthcare market. But first, let's look at what the Brazil healthcare system is made up of. It's called the Family Health Strategy. It's a decentralized healthcare system that offers universal coverage to all its citizens. It started out as a maternal and child program and rapidly developed into the family health strategy. Primary care services are offered to almost 62% of the Brazilian population. Next, we'll discuss innovation.
Thank you, Aquanet. In this section, we discuss the innovations that could be exchanged between US and Brazil. We could import Brazil's community-based healthcare system as a basis of universal health coverage. We could also integrate the community health agents into mainstream healthcare system, creating a strong foundation for primary care and prevention. As far as the innovation that could be exported from the US, we recommend that Brazil adopts electronic health record system and the newer technological advances and medical devices to help provide specialized care. The past and current drivers for healthcare innovation were to improve quality of care, outcomes, reduce cost, increase safety and efficiency. The future drivers are going more towards AI, data and predictive analysis, a movement towards personalized medicine, and overall a more integrated care.
Thank you, Rashmi. We can expect about 5.8% growth in Brazil's healthcare spending over the next 1.5 years and approximately 3.5% in pharma spending. In the US, there is an attempt to move toward a value-based system and more integration of digital health technologies. When we look at the comparison of stats between the US and Brazil, this chart shows a few stark differences. This is an important consideration when evaluating the value of universal coverage, such as that in Brazil, and the cost of healthcare spent per capita in the US, which is just over $10,000 versus a mere $1,000 in Brazil. For example, the infant and maternal mortality rate is more than double in Brazil. However, even with Brazil spending just a fraction of what the US does, their outcomes have improved over time while they're worsening in the US. This is one demonstration that increased spending does not guarantee better health outcomes. Globally, healthcare access and quality, as measured by the HAQ index, improved from 37.6 in 1990 to 54.4 in 2016 on a scale of 0 to 100. For the US, healthcare access and quality increased from 80.7 in 1990 to 88.7, about 8 points, in 2016, while for Brazil, the healthcare access and quality increased from 46.5 in 1990 to 63.8 in 2016.
Thank you, Shante. In this section, we are going to discuss policy changes from the perspective of stakeholders involved. Unlike the US, Brazil offers universal coverage, but they lack the funding and the resources to introduce more specialized and coordinated care. There are multiple payers in the US who may not agree with the government funded universal coverage or even be ready to support a primary care prevention plan. Brazil has one plan, but they lack the resources to support a larger population. The United States has more specialists than primary care physicians, as opposed to Brazil, who focuses mainly on primary care. Unlike the US, Brazil has been able to integrate community health agents into their mainstream healthcare. And this innovation has helped them improve access and outcomes. In the US, these kind of programs are only implemented in certain low socioeconomic class of people. In the US, Large investment is made in the field of drug development, technology, and medical devices. Though there is a rising demand to show the cost effectiveness of these devices. Also, there are many regulatory hurdles before the innovations can be brought into the market. Brazil, on the other hand, is the new hotspot for tech growth. And having only one payer insurance, it may be easier to implement these changes. And all of these new innovations support the patients. The patients, in turn, would benefit from lower cost.
Brazil lacks proper care coordination between transition of care from a primary and specialized setting. To ensure continuity of care, patient safety, medication reconciliation, and treatment compliance, it is imperative that there is an appropriate transfer of data. Since community health agents are lay workers, they may need exact instructions to ascertain better outcomes when it comes to complicated cases. Better care coordination through electronic health records is known to reduce admission rates by 45% and increase compliance in 2/3 of the cases. The strengths and weaknesses of implementing an EHR system is highlighted below. Brazil, having universal health coverage offered by the public system, would make the implementation easier. This would enable them to reduce cost, improve health outcomes, collect accurate data, and make informed policy decisions. However, these changes would require a large initial funding, administrative resources, and extensive training. Their current family health system may not have the infrastructure to support such technology yet either. The largest innovation that the U.S. can adopt is Brazil's community-based care. Several reasons for implementing community-based care in the U.S. are better health outcomes, early diagnosis, lower Medicaid cost, and better access to care, improvements in public health education such as breastfeeding and immunizations, which would all lead to increased health awareness. Some barriers to the implementation would be obviously our decentralized structure on a state level, the many stakeholders mentioned before, each having a different interest, the diverse population in cultural and religious settings, federal funding as well as a priority of spending, and also regulatory issues with community health workers.
Thank you, Tiffany. So we have recommendations now for both healthcare systems. With respect to the US system, we recommend scaling up existing infrastructure to community-based health, implementing those important healthcare agents that help to bridge primary care with public health efforts. We also recommend making available common medications at lower cost to help treat preventable illness. For the Brazilian health system, we recommend innovations such as more access to specialized care and technology, using the investments from foreign governments more wisely to expand their electronic medical record, and also increasing government funding in general. In conclusion, both systems need work. Brazil's family health strategy needs access to specialized care, obviously more government funding. However, it does thrive by fairness and accessibility. The US health system, on the other hand, is less accessible and it costs more. Nonetheless, the system does have good government funding, access to specialized care, and technological resources that Brazil's system is lacking. So what do we take away from this? We take away that a highly functioning health system needs to be patient focused. It needs help from both the government financially and politically, and patients need access to both primary and specialized care with good technology and infrastructure to support universal coverage.
We hope you learned a lot from our presentation, as we did learn a lot and answer a lot of questions in our presentation based on material found in this course. From various chapters in the book, videos in the modules, graphs, and obviously the discussion board that we participate in weekly. Thank you for listening to our presentation. We do look forward to questions and comments.